Hello everybody, this is Gary. Today is July 19th, 2022. It's 4:37 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today my paranoia is not too bad. My delusions are not too bad. My auditory hallucinations are at a minimum. My depression and anxiety aren't that severe. I just finished doing some work on my computer. I'm going to do my physical therapy and bike exercises in a little while. In a few days, on the 26th, I'm seeing my peer support specialist, who is a staff member in my clinic, my mental health clinic, who has a mental health diagnosis herself, and she helps me cope with my own mental health symptoms by helping me through her own personal experience. She is a paid staff member there, a counselor. I also have a separate psychotherapist, which I'm going to see, I believe, on July 29th. And I'm seeing my psychiatrist, I believe, on August 12th. I have a new psychiatrist. I already met with him a couple of weeks ago, and I'm seeing him again in a few weeks on the 12th. That meeting went well. I hate having to change psychiatrist every 1 to 2 years, but that's the way my clinic operates. My clinic is part of the University of Rochester Medical Center, which is a teaching hospital, which means they train resident psychiatrists and resident doctors who come in and work for limited periods of time. Then they moved on to the next phase of their training. So I get a new psychiatrist every 1 to 2 years at my clinic, and I've been at my clinic a long time. It's very difficult to change clinics. If you change clinics, you may have to wait months before you can see a psychiatrist, which means you could go months without medication or psychotherapy, in which manner of time you completely fall apart mentally and become homeless. So I put up with the clinic that I'm at. It's a good clinic, but I hate changing psychiatrists all the time. But that's just part of the way the system is run in this part of the United States, and probably most of the United States, where they have teaching hospitals. I can't afford a private psychiatrist. I don't have that kind of money. My Medicare and Medicaid pays for my psychiatric care and my medications, and I can only go to clinics that accept Medicaid and Medicare. Medicare is my primary health insurance, so I'm limited by my income and my insurance on where I can see a psychiatrist, a psychotherapist, and my peer support specialist. Many people are on waiting lists in this area to see psychiatrists in a clinic if they're not already part of a clinic. You can go months without medication when you need medication. You end up in the psychiatric emergency room more often because you don't have regular outpatient care yet, and it just becomes one big fucking mess. So I just put up with the clinic that I'm at. There's really no other choice that I have. Even when I moved, I didn't change clinics because it really made no difference. I have to take the busway out to my clinic several miles away, and regardless of where I live in the city, I still have to go to the same clinic on the same bus. So that really doesn't make much of a difference about where I live if I'm living in the city. When I lived in the suburbs of Rochester in Brockport, New York, my primary care doctor was the one prescribing all my psychiatric meds because there were no psychiatric clinics in Brockport at the time. I don't live in Brockport, New York anymore, so I don't know what the situation there is right now as far as outpatient psychiatric services. But when I lived in Brockport for 5 or 6 years, all my medications were coming from my primary care doctor, and that's not good because primary care doctors are not really trained to treat schizophrenia and schizoaffective disorder. They're just not trained to do that. I mean, even when I see my primary care, I still see a nurse practitioner and not a physician because there aren't enough physicians in primary care available at the clinic I go to for my primary care. So I see a nurse practitioner who can refer me to a specialist if I need it. But my primary care is technically a physician that I've never actually met. The primary care physician at my clinic really just acts as a supervisor over the other medical staff that are providing the actual medical care, the nurse practitioners, the physician's assistants, the nurses, the ones who are in New York able to prescribe medications and make diagnoses. I don't know what the laws are in the other states, but in New York State, a physician assistant and a nurse practitioner are basically practicing medicine, and they're not physicians. So that's another thing that I have to live with. Don't get me wrong, I'm grateful for all of the care that I do get. At least I'm not homeless, I'm not wandering the streets babbling to myself, talking to my voices. I'm grateful for all of that, and that's why I take my meds. Not much else to report for now. Like, comment, share, subscribe.